Hello and welcome to Bahrain Now, your source of local initiatives, happenings, talents, and trends. I'm your host, Khalid Hijris, here to walk you through our exciting lineup of segments and personalities from around Bahrain. So don't go away, we'll be right back. The Deanship of Student Affairs at the Arabian Gulf University organized a comprehensive eye health awareness campaign aimed at promoting community awareness of eye health and safety. The campaign focused on the importance of raising awareness about eye diseases that may lead to visual impairment if left untreated, as most cases of vision loss can be prevented through early diagnosis and regular eye examinations. And to talk more about that, we are pleased to be joined here at the studio by Dr. Neda Al-Yusuf, consultant eye surgeon at University Hospital and associate professor at the Arabian Gulf University, as well as medical student Noura El-Gharib. Welcome, how are you both doing today?
Thank you very much. We're happy to be here with you.
It's a pleasure to have you both here. Now, I'd like to start by asking you if you can tell us about the eye health awareness campaign organized by the Arabian Gulf University.
Well, the medical students of Arabian Gulf University came up with the idea, and Noura can tell you more about it. And we at the University Hospital has always been eager to do the health awareness campaigns. So when they came up with the idea, we were very happy to supervise and participate and collaborate. And more details on how they come up with the idea will be provided by Noura.
So the idea of your Eyes Matter event, it went by joining multiple ideas by the 5 students, as I have mentioned previously. So then we went out with this Your Eyes Matter event, and it was focusing on the most common eye diseases, like I have mentioned, the red eye, glaucoma, cataract, diabetic retinopathy, as well as smart devices use and their effect on the eye. After that, we focus also on the educational part, and this was started by the educational stations, and the educational content was done by guidance of Dr. Neda Al-Yusuf. And then we do have a clinical part where we do diagnose people, and it was done by Dr. Neda Al-Yusuf. Lastly, we end with the giveaway station. It was sponsored. It was done with the help of our sponsors. And I would like to thank especially the MBK as well as the Avenues Mall with the Arabian Gulf University and the Hospital of the Arabian Gulf University to allow us to have such a wonderful chance to do this campaign.
Wonderful. Now, I'd like to know a little bit about how this campaign started and what were the objectives.
The objectives of the campaign is to increase the awareness of eye diseases, not any eye diseases, but important eye diseases, like eye diseases that are very common and eye diseases that cause visual disability, knowing that early diagnosis and early treatment can prevent visual disabilities. So the students came up with the idea, and I have selected certain eye diseases that I find important to the public. Together with the students, we delivered this information to the public, and we educated the public and increased the awareness of those important eye diseases, particularly those causing visual disability and particularly those that are preventable.
And who supervised and led the campaign activities, and what role did the medical students play in organizing and delivering the campaign?
So our supervisor was Dr. Neda Al-Yusuf. She is a consultant ophthalmologist, and she was guiding us through all the campaign, and she was taking the role of examining the people. Then regarding each role, so starting first with our leader and having general coordinator, he is Ali Taqi. He was responsible for all aspects of the campaign and how to communicate in between each team. Then we have Bandar Shamiri, and he was responsible for the relationships, the part of taking a place in the avenues and so on, as well as the sponsorship, yes. And then we have Amna Al Junaid. So Amna Al Junaid, she was responsible for the giveaway stations as well as the questions. Then we have Isra Al Madrasi, and she was responsible for the social media, so the themes, designs, and so on. Then lastly, me. I was responsible about the academic part and the educational content, and it was under the guidance of Dr. Nada Al Yusuf.
And how did the students exactly prepare to educate the public about eye diseases?
Well, they are medical students after all, and they're between, some of them are year 5, some of them are year 6 medical students, so they already have background about ophthalmology. However, I guided them in the sense that they wouldn't know, like ophthalmology is like a sea of knowledge and diseases and problems. So which to select and what are the important ones to educate and deliver to the public, that was under my guidance, being an experienced ophthalmologist. So I have selected those 5 diseases. I'm going to repeat them because they're important: cataract, glaucoma, diabetic retinopathy, red eye, and the proper use of smart devices. So we have selected those 5 topics, and I have prepared the content in a way to make it simple for the public to understand. We made sure that we don't use sophisticated terms, we use simple terms, and I have delivered the content of that material to the medical students. They have formulated it in a way, and they have added photos and pictures to make it easy and accessible to the general public.
It's wonderful to see the effort that goes into, because for the layman, obviously looking at all of these terms and trying to understand the concepts in the field, I mean, can be quite a difficult task. I mean, even now I'm kind of struggling to understand some of the stuff, but I mean, clearly you guys have made an effort to really paint a picture and make it easy for the public to digest this information. And that leads me to my next question, which is, why are these campaigns so important, especially in the field of eye health?
Because some eye diseases, they are silent, and they can lead to blindness without the person knowing that. So we always insist on screening. And no matter, how many times we do these campaigns and we try and educate, still there are people who lose their sight because of ignorance, because of not knowing that it's important to get their eyes examined, even if they don't have eye symptoms. And namely, the best example is diabetic retinopathy, which is the problems that happen into the retina because of diabetes, as a complication of diabetes. Many diabetics, the problem is there in the eye. They don't know about it. It already started, but they're not aware because they don't have symptoms yet. So this is a very important target to educate people. The other thing is glaucoma, which is a disease that can cause damage to the nerves inside the eye and can lead to blindness. Again, it's like a silent disease that people aren't aware of it, and it can lead to blindness. So if we don't educate people, then people wouldn't know. Of course, there are different ways to educate people on these things. There's the social media and what you're doing now, TV and everything. But one of the means, or one of the methods, is to reach out to the public and be there for them and educate them where they are, like in malls or in other places.
Absolutely, and I think choosing to do it in a mall as well is a great way to kind of catch someone's attention, especially because I think that a lot of us we do take for granted our eyes and a lot of our health in general, so it's a great way to kind of wake people up and kind of catch their attention. Now I'm wondering, are there any specific segments of the population that you guys were trying to target? Is there anyone who's particularly at risk, like you mentioned diabetics, for example?
Well, diabetics, people with family history of glaucoma, even youngsters, if they are wearing glasses and vision is deteriorating, and they may not know, for example, if they have keratoconus, and this is also something important to screen for. It wasn't, keratoconus wasn't put as a station per se, but during the education process and the examination process, we were educating people to other to include other diseases, not only the 5 that we mentioned. So basically, we can say that we targeted almost all age groups in the population: the elderly, the middle-aged, the children, the teenagers. What is interesting is that we came up with some statistics after we finished the campaign, and we found that 33% of people who we screened, they have dry eyes. And we have also noticed that dry eyes was common in all age groups, in the elderly, middle-aged, young adults, teenagers, and even children. And this is probably because of smart devices or the excessive use of smart devices. So to answer your question, we targeted almost everyone.
Oh yeah, it sounds very comprehensive.
Yeah.
And now I'm actually wondering a bit more practically about the campaign. So like what kind of activities were available, and you touched on, for example, like eye exams, but what else was available, and how did the public engage with these activities?
So basically, it's all was by stations, divided into stations. Mainly, we had the educational stations, as I have told you, and it was with an educational content, letting the students review them before they came, and then they start explaining for the public, as well as providing pictures. This helped to attract and engage people, and it will be an easier way to that it will reach their knowledge, because they are not doctors. And also providing them with a free eye checkup. This also engage people to come and do. And lastly, we're ending with the, as I have told you, the giveaway station, because they have to continue all the stations and then to end with the giveaway station. So all of them, they came and they participated with us, and they liked the idea.
I think as well, it's also great that you guys had the eye examination station, because I feel like a lot of people, the scariest thing is kind of taking that first step. So kind of offering it, and especially in a setting like a mall, I think takes a lot of the pressure out of, like, for example, some people are hesitant to go to hospitals and the like. Now, I'd like to ask you a bit about cataract. So why is the cataract kind of considered one of the most widespread eye conditions, and especially amongst the elderly?
It's very common because almost everyone gets it. It's age-related. Everyone after a certain age will get cataract. What cataract is hardening and loss of transparency of the lens inside the eye. The lens inside the eye should be transparent in order to allow vision. But with age, there are some changes that happen into the lens. Changes related to structure, related to fibers, related to the protein being denatured. So that changes the human lens from transparent into an opaque lens, and that interferes with vision, that causes reduction of vision. So this is a process that is related to age. That's why this is the commonest disease among the elderly.
And can you explain what happens if it's left untreated?
Blindness, of course, if it's left untreated, then it will prevent light from entering the eye, and it can lead to blindness. But the surgery is available, and it is simple, and the results are great, and people gain their vision immediately after the surgery. So we have actually detected 15% from those who we saw in the mall, whom their age is between 58 and 70, 15% we have diagnosed cataract. They didn't know that they had cataract, and we diagnosed them in the campaign. So this is one of the aims and one of the successes of the campaign. So we directed them that you have cataract, and this should be treated this way, and you need to seek medical attention and so on. And most importantly, we made it easy for them, without scaring them.
I think that that's a great example of success, that you've kind of actually actualized part of, like, raising the awareness and also preventing, a potential worsening of the condition and leading to treating it. So, I mean, great job there. That's incredible to hear. And now I'd like to go back to, like, for example, like diabetic patients specifically. Why is regular retinal screening so important for them even when they don't have symptoms?
Because diabetic retinopathy comes in stages. In the early stages, it is asymptomatic. in the early stages when there's leakage of fluid or sometimes even leakage of blood into the retina in minute quantities, not affecting the central part of the retina responsible for vision. In that stage, there are no symptoms. So patients wouldn't know that they have a problem. That's why screening is important. Once we screen them and once we diagnose diabetic retinopathy early, then we can treat them early so we prevent visual loss. So we prevent serious complications. That's why screening of diabetic retinopathy early is very important.
Absolutely. And moving on to glaucoma, who is most at risk of developing it?
Those with family history, because glaucoma is a hereditary disease. So those with family history, especially those above 40, all of them should undergo glaucoma screening, and we have explained that to the public. We told them it's measuring the eye pressure and also doing examinations to the optic nerve, which is the nerve inside the eye. So those with family history of glaucoma, to answer your questions, are at particular risk to developing a glaucoma.
Absolutely. And now I'm going to tell myself a little bit. I'm guilty of spending a lot of time in front of a screen. Mm-hmm. And I'm no stranger to eye redness, the occasional eye redness, sometimes when I wake up in the morning, especially after, 4 hours of sleep or something. But when does eye redness kind of go from being kind of like this temporary kind of consequence that you've kind of brought upon yourself to something you should be concerned about?
Well, there's a whole spectrum of diseases related to red eye. There's the simple ones, like the ones just mentioned, like when somebody is just tired and the eye is dry and being in front of the screens for a long time, then there are dryness and there's redness because of dryness. Sometimes redness is so simple, it's just because of, for example, conjunctivitis, which is simple infection. So this is not serious. Most of it is even self-limited disease and can be treated very simply. And in the spectrum, there are diseases that are really serious and can be sight-threatening related to red eyes. And those are that need the most attention. I'll give you just two examples. One of them is acute glaucoma, when there is sudden increase in the eye pressure and there is red eye and there is pain and there's reduction in vision. The other example, there's a disease called uveitis, which means inflammation in the tissue or the structure inside the eye. That is also can be a serious condition and associated with red eye, in addition to reduction in vision and pain and photophobia, which is increase of the eye sensitivity to light. To make a long story short and to make it easier for people to understand, whenever there is red eye but there's no pain and no reduction in vision, then it's a simple type and no need to worry. Whenever there is red eye associated with pain and reduction in vision, then this could be serious, so please seek medical attention for that.
Wonderful, and thank you for that very succinct explanation. And I think that now I feel a lot better about the few times I've had quite a red eye, because it's always been, kind of short term, nothing, it's self-inflicted. And now I want to ask about the 20-20-20 rule and how that helps protect the eyes.
Okay, about the 20-20-20 rule, this is a rule that came up from the American Academy of Ophthalmology, and this rule is set for those who use not all screens, not only smart devices, but also computers. And the rule states that you shouldn't be on the smart device or the computer continuously for more than 20 minutes. So every 20 minutes, you have to rest your eye at least for 20 seconds by looking at something far that is 20 feet away from where you are. So just to make things simple, usually, I tell patients, does your office have a window? And if they say yes, so I tell them every 20 minutes, just move your head away from the screen, look at something far through the window that's at least 20 feet away for 20 seconds, and that will relax your eyes. So this is the 20-20 rule.
Finally, can you tell us about any upcoming campaigns?
Yes, we are this time particularly focusing on schools as well as workplace, and we will try to expand this thing, inshallah.
Inshallah. I'd like to thank you both for joining us. And I'd also like to wish you the best of luck going forward with the future campaigns, because this sounds like an incredible endeavor. Thank you again.
Thank you
so
for
much.
having us. Pleasure for us to be here with you today.
Pleasure is all mine. Thank you again.
Thank you.
Ladies and gentlemen, stay tuned. We have more coming up here on Bahrain Now. This brings us to the end of today's episode. Thank you for watching, and you can always reach out to us on our social media accounts shown below. We love to hear from you. This was Khalid Hidris. Until next time, good night and God bless.